Hey everybody, I'm Eric with Reed's Pharmacy. Here is my co-host,
Taurean.
like Marine, Stuart. We're excited to be here to talk about compounded medications. So we want to dive into it just a little bit for you guys to understand what is compounding, why do we do it, how is it beneficial, and kind of tell you all about some options of compounding, why we got into it, and really how it can benefit you guys. So take it away, Taurean. What is compounding?
Yeah, that's a good question. So compounding, when people hear it, they don't sometimes understand what that is. It's really just the ability for us as pharmacists, with our training and regulations, to specifically make a certain medication for the individual. And that medication can be hormone-based, it could be a topical dermatology cream that's specific. Sometimes we just don't have the answer sitting on the shelf of what we can do. And sometimes the individual needs a few of those ingredients mixed together, combined to have the most synergistic effect. And that's what compounding is. It's being able to use our knowledge of pharmacology and to expand basically the options for a patient to get the treatment they need. So it's revolutionary. We love that we do it. Where do they get it? Obviously, Reed's Pharmacy is one of them. But I guess, why would someone go that route over just getting something off the shelf that their insurance wants to cover?
Yeah, no, that's a great question. And I think we have to talk about why we compound. And I want to go to a couple circumstances that pop out to me as to like, hey, this is like one of the big reasons why we compound and why it's fulfilling and satisfying to us. So I'll say, first of all, I look at pediatrics. I look at when Taurean's talking about the drugs on the shelf, like they aren't necessarily made for pediatric patients because they're like tablets, right? And they don't come in smaller dosage forms. So I think about patients that we make blood pressure medications for in a liquid form. They couldn't get in any other way, right? And it's affordable. It's something that they can manage on a monthly basis. There's been medications we just recently did for a little girl that's had all kind of inflammatory IBS issues, and she could not get this medication in another form. We were able to compound it to make it so she could get feeling better. So those are super simple examples of how compounding can be beneficial. And then we start looking at, like Taurean said, all of these other options of fine-tuning your dosing with thyroid medications, with making bioidentical hormones to the exact amount of milligrams that your body needs and adjust it accordingly. And so it's so cool to be able to tailor these specific compounds to your needs. And so when we talk about this, people probably are wondering, okay, well, you're making it here in the pharmacy. So I guess to clarify for everybody, Taurean, how do we make it? Like, what kind of equipment are we using, and is it safe?
Yeah, that's a good question. The equipment we use is specialized equipment that is designed to measure out, to know exactly the milligrams, the weight, and really make sure everything's validated correctly on the scales, right? Every job or profession has different equipment to help them get their job done, right? Whether it's a mechanic with his tools, or someone who's doing concrete and using different leveling systems to make sure the concrete's level. We as pharmacists and compounders have the ability to measure and weigh out and make sure everything is specific within those parameters. One thing we also do is, we've been doing this for years, but we have all the validation tests with all the proper chemicals and the ingredients that are verified and tested. Even the state comes in, and we do a great job on all those, getting it passed off and regulated in the correct manner. So it's extremely safe, it's extremely specific, and I like that it's an individual choice, meaning someone can get exactly what they want, and they can do that without having to go through their insurance and be told what kind of treatment options are available. So that's some of the pros of our setup and how they can access that medication. So let's talk really quick. Why are some pharmacies not doing it? And also, why would insurance not cover it? Kind of the FDA stance on that, if you wouldn't mind.
Yeah. So, I mean, number one is it is a commitment. So I can't tell you how much training we've gone through to make sure we're on top of things, because we have to know what we're doing, what we're looking at, making sure that things work in harmony. And so there's a big commitment as far as the pharmacy personnel, your pharmacist. as far as the training goes and the upkeep and keeping on top of those regulations, keeping on top of the knowledge base. And then, like you mentioned, equipment, right? You have to have a separate lab with all this high-tech equipment that actually can pulverize, can put the powders together into a cream to make it so it'll actually absorb. And so all this equipment is super expensive as well. And so, yeah, and it's not something that every pharmacy is going to do because of the amount of time, energy, knowledge that all goes into that. Yeah. And so I think for us, it's just an awesome thing to be able to be part of that and to be able to provide patient access to things. I mean, we've seen in the past all these shortages, right? Like top of mind, everyone's going to think, oh, Ozempic, Mounjaro, like the GLPs, right? And so those things have been in short supply over the past years. And compounding pharmacies were the ones who were able to come forward to fulfill that demand, to help people with, I mean, honestly, tremendous results and change of lifestyles. I mean, helping people feel so much better by having access to these things that they couldn't otherwise. And so I think that's just a prime example of how compounding can be so beneficial.
Yeah, and really quick, so everything you see, behind the counter in a pharmacy has been FDA approved and regulated. Everything on the shelves, the bottles, for example, Prozac. Everyone knows kind of what Prozac is. That's been FDA approved. And so the FDA has their stamp of approval on those medications. Now you can imagine they don't have time to come in and specifically stamp their approval on every medication made individually for every patient across the country. So they give us the authority to do so. But with that being said, they're not going to come in and stamp their approval. So the medications are not FDA approved in the sense that they've gone through the same testing as some of those on the shelves, but they are exactly the same ingredients. A lot of times we take out the inactive and the unnecessary fillers that make people feel a little bit different or off. And it's actually a very pure product. And that's why insurances aren't going to be paying for that. So the benefit is you're getting a specific individualized treatment and you can pay for it. You can feel good you're going to get it. And the insurance is not going to block it or say, hey, it's not available. So that's what I like, is it's access to better health care for individuals that need that treatment.
Yeah, and when you bring up insurance, I mean, nowadays, shoot, insurance is so expensive, high deductibles, so prescription medications can be really expensive. I would say overall, compounding, super affordable. I think sometimes that's a misnomer. Yeah. People think, oh, it's going to be a specialized product just for me. It's going to be way expensive. It's not. Like, a lot of times the compound options that we provide are cheaper and, like you said, I mean, tailor-based to your needs, and they're more affordable. So I think, like, open your mind to the possibility of, hey, what kind of options are out there that maybe I could be looking at, whether it's hormones. I think hormones probably comes top of mind because at some point in your life, most people are going to need some type of hormone to get you back on track to feeling well, or thyroid medication. We've discussed that before. Pain creams, like there's so many options. It's so cool to just be able to talk about this stuff.
Management, right?
Yeah, so many cool things with compounded medications.
Many times when we're looking at claims, we can see that actually our option through compounding is way less expensive than the copays that we see through insurance. So don't be shy to ask us. We're very competitive and open with our pricing. We're here to help you guys. And it's us working collaboratively with your doctor to get the right dose, the right medication for you. And that's what compounding is all about. It's a specialty art that we're glad we do, and we're excited to help you out with. Any last words, Eric?
I would just say, if you have questions about it at all, if you're thinking, hey, that could be an option for me, just come talk to us.
Yeah.
Like, there's so many doctors now, especially in our valley, that are open-minded to think to the idea of compounding because they've seen the benefit. They've seen the results. Like, they've seen that it is safe. And so come in and talk to us. We're just happy to be here to kind of share what we know, our years of experience, to find solutions to help you guys.
Thanks again, you guys. Appreciate it. Bye-bye.